According to the Cleveland Clinic, chronic venous insufficiency usually affects people over age 50. The risk goes up the older you get. Besides diminished performance of your legs, ulcers, spider veins, and varicose veins are also unsightly and unhealthy. Like many health issues, it doesn't go away on its own. Our next guest can help you get back into the flow of things, and unlike previous years, the process is comfortable and quick. Dr. Tony Reincke with Reincke Vein Center joins us to share how it works. Good morning, Dr. Reincke.
Good morning.
All right. As I mentioned earlier, it's the process is like comfortable and quick. There are a lot of people who look at having, venous insufficiency and they think I'll just deal with it because they're afraid of what the cure might be. You know what the cure used to be. It is not like that anymore.
Correct. So there's no cure for vein disease, but there's treatments, and the treatments are minimally invasive. They're done in the office. Patients have no downtime. They're back to their normal activities the same day.
Yeah. When you say there's no cure, but the treatment gives the relief, which is what they're seeking.
Exactly. Yes. So depending on their symptoms, we shut down veins, right? These are big stretched out veins. They have backward blood flow. They're causing patients symptoms. We get them shut down. Boom, they're back to their normal activities immediately after.
Yeah, I mentioned that most likely people over 50, you've seen younger people as well. We're looking at some pictures right now. A lot of people feel like this is a cosmetic issue and they may be going to a dermatologist or someone like that. Or if their legs are tired, they're thinking it's a muscular issue. Really, it's what lies beneath, and that is vein disease. What causes vein disease?
The most common risk factor for vein disease is genetic, and then age over 50, for women, multiple pregnancies, obesity, and occupation where you sit or stand. Those are the most common.
Yeah.
Having a genetic predisposition or hereditary predisposition, if one of your parents have it, you have up to a 50% chance. Add both your parents in, and now it's increased to 90% chance.
Yeah, you say parents, I want people to know that if your parents went through that vein stripping process, that's not what we do anymore. You witnessed that, and you were a recovery nurse for that procedure, which is kind of what led you going into doing this procedure, which is, the newest technology and comfortable. I mentioned a couple of the symptoms people might have. What other symptoms should people keep in mind?
I think a common one that people sort of overlook is swelling. So swelling in their legs, restless legs, night cramps. Those are additional signs or symptoms that patients would want to consider. Maybe I have vein disease.
Yeah, and the process for you to confirm that is fairly quick and easy too.
Yes. So patient comes in, they have these symptoms, maybe some bulging or visible veins. We do an ultrasound in my office, which is a diagnostic comprehensive ultrasound examination. It takes maybe 30 or 40 minutes. I evaluate the images on the ultrasound, and then I talk to the patient the same day. So it's immediately after the ultrasound. Everything is done over. They probably spend an hour in the office. This is after a full physical examination.
Yeah, and nothing invasive, right? Nothing invasive.
Correct.
Okay.
No.
All right, now let's get to the actual procedure. So we established that they have vein disease. You can tell which veins are not playing right. And so what does the actual procedure look and feel like?
The actual procedure takes me maybe 10 or 15 minutes. It's done with ultrasound, numbing medication, and then a small catheter, which is like a flexible straw, numb up their skin, put the catheter inside the vein. Lots of numbing medication goes around the vein. I heat it and I seal it shut. Again, it takes me 10 or 15 minutes. The area, I make a small cut to go in with the catheter. That's pulled together with some steri strips, put a dressing on. They go walk for 15 minutes.
Yeah, and what's so nice about this is that I've taken a friend to get the procedure done, and she got up and walked out and went, wow, she goes, I took off the rest of the day at work for this. She goes, I really could be back at work, but I'm not going. So, because you are kind of up and at, but people start to see results fairly quickly, right?
Yeah, it can be. I would say, I think patients are surprised sometimes as soon as the next day. It's probably not the majority of my patients, but absolutely they can. So once you shunt those veins down, you get that pressure off of their leg. Some patients will feel immediate relief.
Yeah. And this is, again, one of those things I mentioned that it doesn't go away on its own. Sometimes we like to compensate for things. And this, if gone untreated, can lead to what types of things?
So over long periods of time, it's possible that you can get skin discoloration, like darkening of your skin, scarring down of your skin, and even open wounds. Those open wounds are not going to close on their own. And so, course, I feel like it's better to get treated sooner than later. We definitely don't want you to get to the point where you've got bleeding veins or open wounds.
Yeah, and the tough part is that if somebody is just treating open wounds without having ever treated the vein disease, again, we're treating a symptom but not the cause.
That's correct. So sometimes you need like multimodality or multi-subspecialty physicians to treat you. Maybe it's wound care, which is not my specialty, but I will refer patients or they'll refer patients to me. So you may need wound care, even vascular surgery, if a patient needs like a skin flap for that area that's open, and then myself to close down the veins.
And let me wrap it up with another thing that stops people from getting treatment is cost, but this is one of those things that insurance in most cases is going to take care of.
It does. Yes, ma'am.
All right. Dr. Reincke, thank you very much.
Thank you.
Reincke Vein Center has a special offer. Mention Great Day Houston to receive a free consultation. Call them at 281-394-4446. Again, that's 281-394-4446. You can also visit their website at ReinckeVeinCenter.com to fill out the online inquiry form. Also, they make time to make flexible hours if that is a concern that you have as well.